Welcome to the ONEder Podcast. This is your host, CCB, and we are excited to offer another outlook or exploration into one of the areas that we build spaces for. And first off, I'm going to say, remember that the ONEder Podcast is available on all your streaming services. So if you need to get out there and listen to more, on Apple, it's on Spotify, it's ONEder Podcast. And feel free to rate them or send us a note and tell us what you think. We're always looking forward to hearing from our listeners. Today's episode, which I believe is number 63 of the ONEder Podcast, we're going to be talking with Dr. Justin Mohatt, and we get to call him Justin, so everyone be prepared for a little bit of familiarity. And in an interesting way, it makes so much sense because we're talking about behavioral health and the spaces that are created to provide the services that are required today. And everyone's heard the stories about how much impact COVID had on our ability to collaborate, to be social, and what's going on with kids today and the impact of technology and the isolation that sometimes comes about from utilization of those tools. So it's such a prevalent topic for all of us. It's not just about the space, but it's about people in our community. And it has very pervasive impact at this moment in time. So I'm going to say welcome, Justin. Thank you for joining us.
It's my pleasure, CCB. Thank you for having me.
Justin is part of an amazing facility that we'll delve into a little bit more deeply. But before we get to that, I wanted to ask you to tell us a little bit about your background and how you came to focus on behavioral health and the segment of the population that you work with.
Sure, happy to. And I guess first I'll just say, currently I'm the medical director at Ohana, which we're going to be talking about, and head of innovation here. I've had a circuitous route to this particular role, but I think the roots of me being interested in mental health, landing in this field in general, come from very early on. I think for, like a lot of people, we have personal stories that inform where we end up. And many people in my family are in the mental health field. I didn't think I would go into it for a long time, but I think the draw was inescapable. I had a grandmother who had suffered with severe chronic mental illness throughout her life and had a very traumatic upbringing. We got to, fortunately for us, spend time with her every year, which I think isn't always the case when you have a family member with severe mental illness. I think it gave me a deep sense of empathy and wanting things to be better for other people. I think that as it pertains to this podcast and the idea of space and design, she was institutionalized most of her life and in state hospitals. Those places were very scary and very scary as a kid going to pick her up for summer vacations. And so the idea that the experience for patients and families could be fundamentally different is incredibly important to me.
Thank you for sharing that. And I do think when, as you know, in opening remarks, when I think about the impact that this conversation has on a much broader set of our listeners, because there is so much, if the stats are 1 in 7 Americans have some form of some diagnosable mental health challenge, you just think, of course, it is everywhere. And if we are working on environments that make people feel more comfortable and are able to be their best, areas that need more attention deserve more attention. So that's one of the reasons why we were delighted to have you join us and talk about the Ohana Montage Health facility. So that kind of introduces what the project is, but I mean, what your location is, but help us understand who is being served in this facility.
Sure. So Ohana is a youth mental health program, and we think about that in the broadest sense of the word. So the bulk of the patients that we see are 17 and under. However, we do have a growing population of young adults in that transitional age category that we are also serving. Part of the fundamental goal for us is not just to treat mental health concerns when they rise or after they've been in place for a while, but to do as much as we can to prevent. So we also are treating some adults in our program because we believe that the most important place to begin prevention is prenatally. So we've developed a reproductive psychiatry program to treat expecting parents with the hopes that we can sort of intervene at the very earliest stages when either parent may be struggling with something like depression or anxiety. So we see a broad range of patients from an age standpoint, though the bulk are teens and younger children. And we are serving kids who require a variety of levels of care, everything from outpatient treatment, like you might think of with therapy, medications if appropriate, occupational therapy, and up through day hospital programs, intensive outpatient programs. And we just opened this past month our residential treatment center for teenagers, so 12 to 17, who are willing to come in for treatment. It's not a locked inpatient psychiatric unit, but who need that higher level of 24-hour-a-day care.
So that's going to make me think about we talked a little bit before we jumped on the podcast, but the idea of there's community, which is supportive of recovery from whatever your challenge is. And then there's safety. So there's this balance between how are you, and if you're talking about it's not a locked facility, but it is, there's the opportunity, if you will, for someone to have some level of crisis while they're with you. So how does your staff think through that? I'm going to say A, and B, how did the space get designed to be supportive of your process?
I think from a staffing standpoint, we invest very heavily from day one on training and making sure that we have operational processes in place that support people so that they feel like if they're in the room with someone who's having a crisis, they're not alone with that, and that we have a very clear protocol for how you ask for help and who responds and within what time. And as the building has evolved, as it's opened and all of our services have come online, that has become necessarily more complicated. And then certain parts of the building have their own systems for managing patients within that particular area. So I think from a staffing standpoint, it's all about training, effective communication, and having easy operational workflows. The building supports all of that. And a lot of thought went into the design of the building to make sure that in addition to its many other features, it provides a safe place for patients, parents, and staff who are here. And we recognize that kids at any level of care, be that a regular outpatient therapy appointment or a kid in residential, could be in a crisis at any moment. And so we had to think about that, not just for our kids in the residential program or the day hospital program. So throughout the building, there are cool down spaces for kids and staff to take space. They're not seclusion restraint rooms. They are more like a meditation space, a quiet reflective space, so that they can kind of get some physical space if that's what they need, as well as a quiet space. We also have an alert system for staff that just requires the press of a button to call for help, and then they don't have to worry about if people are going to come and who's going to come. We also have a lot of space to move. That, I think, is a critical part of just the built-in environment that makes such a difference. There's nothing that enhances anxiety and distress more than feeling restrained and cooped up and like you can't get out. When you walk into this building, it's large, airy, open spaces. There's plenty of furniture for what we need, but a lot of just empty, negative space to allow for that sense of, I think, freedom. Within the sort of internal waiting rooms of the clinic, there's also freedom of movement there so that people aren't necessarily feeling like they're overly contained. We also have outdoor space for patients and outdoor space that's specifically for staff, again, to sort of allow people to kind of get where they need to be. I guess that's less for safety and more for well-being, and we can talk more about that later. So I guess I would just say that it's sort of built into every part of the building.
Which makes me jump to the thoughtfulness and the planning and programming of the entire facility. And you mentioned the fact that you had been there for 3 years, so you weren't a part of the initial programming. But we know that, and I'm going to say caveat to listeners, there will be a link to the project case study about Ohana Montage that's also on our website, so you can see some of the images of the facility that we're talking about. The planning clearly spent a lot of time on the entire process and what the vision for what the environment might look like and feel like and provide. And could you just spend a little bit of time talking about that, even though it's hearsay on your part?
Right. Yeah, I know that a lot of time was spent with consultants, not just hearing from us as clinicians about what we would want, but also hearing from the community, hearing from some of our youth themselves about what was important to them in the space, and even including them in some of the design process and specifically around some of the art that was installed in the building. So as opposed to, I think, a lot of buildings like this that get designed to just meet regulatory requirements, there was a lot of conversation about how do we meet what we need to meet from a safety and regulatory standpoint without it feeling institutional in any way. And so when you walk into the building, it really feels more like you're walking into a hotel lobby as opposed to...
Or a resort. It's so beautiful.
It's like a beautiful Hawaiian resort building in the hills of Monterey. It's a pretty spectacular space.
It truly is. So you introduced the well-being word, which is such a big buzzword today for almost every environment. And that, I think, is also interesting because the underlying concern there is that so many people are a little out of balance. So to think that all environments should consider, the wellness and well-being of others, that has been a requirement in certain types of building for a while, and it's certainly an aspiration in creating environments. And when you're talking about healthcare, behavioral health, it's obviously, it steps up on the priority level of, what are we trying to do? And I will also point out that you very kindly addressed the wellness and well-being of not only the patients, but the staff who are providing and involved in, kind of stressful situations on occasion, and the families, the visitors, and the community. And to say that it looks like a Hawaiian spa in the Monterey Hills is not an understatement. And you know what the feeling is when someone approaches a location like that it just lowers your blood pressure. Holy samoli, looks at this beautiful environment. So that's a lot of blah, blah to get us to wellness and well-being, that the intention is so well delivered.
Yeah, I think that kind of zooming out a little bit, you can't have wellness if you are entering an environment that makes you feel unvalued. And that, unfortunately, is the case for most youth mental health and just mental health facilities in general. And I would say pediatrics in general is kind of an under-resourced area outside of, beautiful, newly built children's hospitals at large academic centers. Even in those amazing places, I mean, this is the first place that I've worked, and I've had a number of steps in my career where the children's mental health just waiting room wasn't essentially a back room or a basement room somewhere with an island of misfit toys of furniture that were falling apart, because the work we do does not make money. And so we're blessed to have had this amazing gift through just an incredible human being that helps us develop this. But in the long term, our goal is to be good shepherds of this gift in such a way that we can develop, iterate, come out of the other end with a program that enhances health, well-being, and mental fitness for the children and families we serve, the community we serve, which is really important to us, and have it be a model that can be deployed in all kinds of communities around the country who don't have a $100 million gift to help. But if we can do the work of figuring out what those key portions of the intervention and the built environment are, so that we can say, here's where to invest the money you do have, then that is a bigger impact than even just the work we're doing for our own community. From a well-being standpoint, I already spoke about that sense of when you come in, it's just high ceilings, open spaces, lots of glass. The connection between inside and outside is pretty seamless. Every clinical office, with the exception of some internal group rooms, have large windows in them. So you never feel like you're closed off from the outside. We have a couple of beautiful interior courtyards where you can go to take a break, but also it always makes me happy when I walk by and look down into the courtyard and see therapists out on the grass with patients doing the work outside of the four walls of an office. The art program here is another key component, I think, to the health and well-being, and I can talk more about that. And then we've got specific spaces for staff throughout the building that are meant to give them pop-off space, such as, there are 3 staff-only outside spaces where, we've encouraged people to not go and work, to go and get a break from work. I think people do work out there because it's such a nice place to work, but the idea was the work we're doing, the work our patients are doing is so hard. We want people to have an opportunity to recharge and fill their batteries during the day.
Okay, so there's 2 things in your last comments that I kind of want to take a little bit further. And one is the community aspect of it and the collaboration with community. And so what does that do they're connected, these 2 thoughts. What does that do for, patients and treatment? Kind of like the efficacy, but the value of, moving the treatment along by still being a part of community. And the other side of that coin is the destigmatization, I can say that word out loud, of an illness that is an illness and might have had different connotations in, historical, concern around it. So you've got 2 things going on there. You're destigmatizing through the space, through the environment, but also through the active engagement with community. So could you talk about that?
Yeah, I do think it ultimately comes back to destigmatizing. And we didn't want this building to be a hospital on the hill that people in town just talk about, oh, you go up the hill to Ohana to get treatment. We really wanted to be a place that is a welcoming, safe, and desirable place to be, and where the community wants to come here. So in addition to providing services for patients in treatment, we do a lot of community programming in the building. Part of the design of the building was to have an education and conference center within the building. So you're coming into the main entrance there, and we have free community classes throughout the week. Most of those are prevention-based programs. And then we have this prevention team that runs a lot of those classes, who are also out in the community every day, meeting with stakeholders, intervening in the schools. We have a school-based program to build mental fitness, again, with the idea of how do we teach kids how to flex these muscles early so that they don't develop mental health issues later, or we minimize the impact of what may be coming online just naturally through genetics or whatever. So I think that we're trying to break that stigma down, as you said, by having a beautiful space that doesn't feel like an institution, but also going out into the community, inviting people in, offering as much as we can free prevention programming, educational services that you can attend regardless of what your situation is financially or transportation-wise, because we do a lot of those virtually as well, so that families from, we're a very large county, and we want families from North County and South County to be able to access classes and services as easily as somebody that lives, 5 miles from here. So I don't know if that answers your question.
Yeah, I think it does answer the question, because it is the intentional destigmatizing, now that I can say the word without the Asian on it. But thoughtfully, it's so interwoven and holistic into everything that you're doing at Ohana. So it obviously feels successful, and you're going to tell us how successful it is.
Yeah, and I think we're early in our development still, and hope to have a lot of great outcomes measures for the future. But we are still just getting programs up and running. I will say one other thing from a destigmatizing standpoint that is critical and has helped us in our development process, but I also think begins a different kind of conversation with the youth community, is that we have a youth advisory council that we have developed that is made up of high school students who've expressed interest in having input in what we do. And they had input from early on, including we have a beautiful mural piece in the waiting room, this large-scale mural done by an artist, Leah Rosenberg, that was donated. And it's ribbons of color that kind of interweave and then move away from each other. And she worked with our youth to pick the colors based on what they responded to and what they wanted it to represent. So they were involved at that stage. They're involved actively with me in my innovation role around thinking about digital interventions and what might work, what would be appealing to them. They always are brutally honest and give great feedback, and you think you have the best idea on earth, and they look at you like you've grown 5 heads. And it's so important, because without them, we would get it wrong so many times. But I think having them in their schools talking about this experience, we've never had a shortage of students wanting to be on the council, so we rotate it. It's not a forever position. And that breaks down stigma as well, and I think puts us out in the community in a different way.
Okay, so you're clearly very proud of the art program, not only Leah Rosenberg's piece. So tell us a little bit more about that.
Well, I think that it's hard to talk about it without talking about CHOMP, which is the Community Hospital of Monterey Peninsula, which is we're a department technically of the community hospital. And the community hospital was one of the first hospitals in the country to have an art in medicine program. They've had an art collection since the 1960s, I believe, with the understanding from research that art can be healing. And then that flowed into the design process here. And so we had a team of art consultants, a curator that helped pick art for the building. Again, very intentionally to try and have the art be pieces that can be engaged with in treatment, that could actually be used actively. Each piece has a QR code and an explanation of what it is, but also with prompts of questions for people to think about. It's everything from tiny little pieces to these sort of more monumental murals. And it makes coming to work feel like a very different experience. And the response has been tremendous from families. So I had one of my adolescent patients who is just really funny. I ran into them in the waiting room, or in the, sort of the entryway one day on the first week that we had been opened. And they call me Mohatt. They don't call me Dr. Mohatt. And they said, Mohatt, why is this place so fancy? And I very quickly just instinctually responded, because you deserve it. And that really is kind of the heart behind this, is that if you build a place that makes people feel valued, they will feel valued. And it says so much about how much we care about them as kids, as families, that we want them to have this kind of space to be in. And I think that often gets lost in designing institutional spaces for medicine in general, is like, what is this message that you're imparting to somebody walking into this space? And I think there's no way that a family walking into this space wouldn't feel like, oh, I'm worth investing in. And usually you don't have spaces like this outside of higher end cash only types of clinics. And so to be in a space where we take public and private insurance and we treat everybody from every walk of life that we can, it's a unique experience as a provider as well.
You're a great spokesperson for the space and for the programs that you're conducting there. I'm curious, what does innovation director or leader mean? And it's just an interesting. Help us understand.
Well, I think that's the $1 million question. I think often with that title. I think that I've come to appreciate two kinds of innovation in this role. One is sort of what I would call little I innovation, and then big I innovation. And I would say the bulk of my innovation work at this stage is on the little I side, and it's really making sure that we are thinking through our processes, what we're offering, are there new treatments available? And I'm not talking digital stuff that we want to be bringing in and trying in our setting. And then there's the big I innovation piece, which is more digital interventions. How can we use tech to do what we're doing better? And we are looking at, I think, very careful ways, what are places where we could use technology to improve what we're offering. And from my perspective, that often comes down to improving access and equity in the care that we're providing. So we're exploring a purpose-built video visit platform for delivering youth mental health treatment that might be able to allow our patients who can't actually physically get here as easily to have a more equal treatment experience. And we're looking at remote patient monitoring devices so that families don't have to come in to get vital signs done every time. If, again, we've got families where it's a 2-hour drive each way in our county to come for an appointment. And if you want a kid to have a normal kid life, you don't want them in a car 4 hours a week or more coming to therapy appointments. So we want to do everything we can to ensure access and equity. And when I think about innovation, those are the things that are highest on my list.
Those conversations about access and equity are certainly loud, much more loud these days, which is lovely because there have been people that have been working on it, but to have a spotlight put on it, an emphasis that there's a much broader conversation around it. It feels like at least we might be moving, closer in that direction. And I say that because, quite frankly, X number of years ago, I had a conversation with some behavioral health providers, and it felt so much more fraught with anxiety. Just like what the hurdles are so monumental on occasion that it just feels like how do we pull ourselves together and muster the energy, and to think that there are advances being made and there is attention being paid to it is fantastic. So my goodness. Okay, so we kind of talked about measuring success, and I'm just wondering, like, what's the plan? I mean, I think there's standard measurement that happens regulatory wise, but are there other metrics that you and Ohana are holding yourself accountable to?
It's such a good question, and it is such a hard question to answer. This is an area that our field in general is way behind on. We don't have a deep library or even a very shallow library of agreed upon standard quality measures. And then when you're trying to do things a little outside of the box and you're thinking about how do we, for instance, bring down the prevalence of youth mental health in our county, that's a long-term question to try and answer. I mean, that's certainly something we're looking at. Our big goal is, can we bring that incidence down from wherever it currently is, because that's a moving target and it's gotten worse with the pandemic, to whatever the percentage is that is truly hardwired, genetically driven stuff that would come online no matter what you did. That would be an amazing goal to meet. That's ambitious and going to take a long time to figure out. In the interim, you're right. It's a lot of the low-hanging fruit is how do we sort of meet the regulatory quality requirements that everyone should be doing. That is essential to be focused on at the very beginning when you're starting. And then we're starting to look at how we can validate some of the measures that we've come up with around building mental fitness in youth and assessing mental fitness in families. So we're working right now on validating some measures that we've developed. And then we're also looking at measuring outcomes for our specific programs and interventions to be able to say, yes, this works. So a good example of that would be in our adolescent partial hospital program, which is the day program. Kids come Monday through Friday, basically during school hours, and get intensive group therapy and medication management. One of the things that we've done, which is unique, not entirely unique to us, but not typical in most partial hospital programs outside of the eating disorder world, is have one day a week that's a family day. So this gets back to Ohana and what Ohana means and our kind of mission to treat families. We recognize that there is no child without a family. And most programs have the kid there all day, but the parents maybe get 1 hour of a parent meeting a week. We're trying to see if we can move that needle more by having we have an entire day of the week where the family has to be there and the parents are in treatment all day with the kid. And so that's a place where we need to measure what do those outcomes look like compared to more of a standard partial hospital program. And that idea came from a colleague of mine, our other medical director, who ran an eating disorder program prior to coming here and was really interested in why that wasn't more the model everywhere, given that family is so critical to treatment.
Geez, I am so blown away by everything that's happening. And as we're sitting here having this conversation, which is drawing to an end, I was wondering how many people are at your doorstep. What does wanting to be a part of is by virtue of the kind of the elements that are the attributes that are so unique about Ohana. Are you seeing more? And that's odd to say, but is there more interest from patients and families to be a part of?
Well, I think that the reality is that the demand is so high for services everywhere in the country. And this county is a largely rural county. Prior to Ohana, there were almost no services for families with commercial insurance. Families who were affluent and could pay out of pocket had a few options for people they could see. And patients on Medi-Cal did have options, but there was this in-between group of patients who is really the bulk of our patients with some sort of commercial insurance, or we see a lot of military families with TRICARE who had nobody to go to. And so that plus the pandemic, I think, like drinking from a fire hydrant for a while when we opened, and a lot of kids who had been in crisis probably for years before that. So the acuity was really, really high. So there has not been a shortage of patients. I would say that things are normalizing more now. And so for outpatient has always been really busy with our day hospital program, which is growing now and we hope will grow significantly in the coming year. And then opening of our residential, we're going to be broadening who we treat beyond just Monterey County to surrounding counties. And for residential, probably even further a field to make sure that that resource is well utilized. But yeah, we have more calls each week than we can necessarily see, but we also are getting people in much quicker than the average nationally. I would say what's harder, and this is again true everywhere, is finding enough qualified staff who can do the work to meet the demand of the patients. No matter how beautiful your facility is, there is a huge national shortage of youth mental health providers. There's 1 in 5 kids that have a diagnosable mental illness. Only about 50% of them will ever get treatment for their illness. And just speaking specifically about psychiatry, child psychiatrists, the number of psychiatrists per kid in the country, there's 16 psychiatrists for every 100,000 kids in the country.
16?
16. And there's a huge range depending on how rural a county is, anywhere from 4 to 65. But we have about a quarter of the child psychiatrists we need in the country. And that is true of psychologists, it's true of social workers. So I think for everybody in this field, that's one of the hardest aspects of it. So we're also trying to utilize our staff as well and as efficiently as we can without burning them out, because the burnout rates for mental health providers are also sky high, which comes back to our earlier conversation about well-being and staff. But there's no shortage of patients. We don't have a shortage of providers, but it's definitely our biggest challenge is recruiting and finding people. So.
Well, I'm just going to say to everyone who's listening, if you have people that are interested in behavioral health as a profession, encourage them to look into that, diminish that extreme need. And I am going to say that it's like the end of our time, which we could sit here and talk to Justin Mohatt a heck of a lot longer. But is there anything that you'd like to, you get last say, so is there anything you'd like to share that we haven't talked about?
No, I just hope that the conversation that was jump-started in the last few years, I think not entirely, but largely by the pandemic around youth mental health and the crisis that our kids are experiencing, continues, and that every opportunity to talk about it, be it on your podcast or in other settings, I hope that that conversation continues. And I hope that more facilities will see how important it is to invest in it, and that by doing so, not only are you doing the right thing, but you're also sending a message that has a bigger impact in terms of destigmatizing care, which then means people will actually show up and get the care that they need. And so I just appreciate an opportunity to even talk about the work we're doing and more broadly, youth mental health.
Thank you very much, Dr. Justin Mohatt from Montage Health Ohana Center for Youth Behavioral Health. And we will look forward to having our listeners join us again for another ONEder podcast in the future, where someone else with an amazing passion for what they do will share their story with us. Thank you and goodbye.